Today we're going to do a Q&A with Shireen, our office manager and coordinator.
So I'm going to ask you a few questions that people typically ask when they call the office.
Right.
The first one is, what is a body lift?
Wow. Okay, great question. So a body lift is essentially a procedure that was devised to lift your lower body. And that we have lower body lift and upper body lift, but typically most people refer to a body lift as a lower body lift rather than upper body lift. And that's actually my preferred way too. Now, a lower body lift is what your plastic surgeon puts into the procedure, meaning that you get a 360-degree incision above your buttocks, coming over your hips, outer thighs, and then on your lower abdomen, as you know. And then through the procedure, the plastic surgeon can do 1, 2, 3, 4, 5, 6 procedures. So a lower body lift is a very ambiguous term, and most patients have to appreciate what goes into it. For example, as you know, we have circumferential abdominoplasty or a belt lipectomy, and people call us all the time and say, I want to have a circumferential abdominoplasty. And we don't do that. I mean, we can do that, but it's an inferior lower body lift. That's what I call a basic body lift. Why? Because the circumferential abdominoplasty is essentially removing the abdominal roll, the hip rolls, and doing a butt lift. And our body lifts are very different.
Exactly. So when patients call, they'll say, well, Dr. So-and-so told me that I just need a tummy tuck and I don't need a body lift, but my thighs are what bother me the most. And that question comes up every single day.
Right.
So I want you to explain to patients the way I try to explain, incorporate the lower body lift they don't associate with thigh procedures, and how we differentiate in our lower body lifts and the type of correction we get versus the type of correction the average patient gets with the average plastic surgeon.
Correct. That's like a loaded question. It's like two questions. The average plastic surgeon, under training, and what we offer. So we'll come back to that. But talking about a lower body lift, again, it's important to understand what goes into your lower body lift. The lower body lifts that we do, and I've been doing them for 19 years now, are very different. It's very comprehensive. You get a monsplasty, which is pubic lift. You get complete correction of the abdominal contour, which is an abdominoplasty with muscle tightening. Sometimes I'm repairing umbilical hernias or ventral hernias or hernias due to ports. We do an outer thigh lift, a thigh front lift that is not actually in any plastic surgery textbook, a waist reduction, lower back skin excision, buttock lift. That's about it with the lower body lift. So it's not a circumferential abdominoplasty. It's not a belt lipectomy. It's not removing that roll. It's the same incision, but there is a lot more work that is being done through that incision. As an example, you get an outer thigh lift with the high definition lower body lift that we offer. And to do the outer thigh, to lift it up, we pass an instrument to dissociate or elevate the outer thigh tissue from the muscle. Then I elevate the outer thigh and then I resuture it back to the muscle. So you get anchoring suturing of the outer thigh and elevation of the thigh. And that doesn't come with a circumferential abdominoplasty or a belt lipectomy.